Welcome, everybody. It is Thursday night, and we are here with one of my favorite people, Dr. Ann Bynum. Thank you so much for joining us on Airway Circle today.
Absolutely. Thank you for having me. I've seen your past guests, and it's big shoes to fill.
Well, you're one of them. So thank you so much. So, guys, I'm going to start introducing Dr. Bynum to everybody. Dr. Ann Bynum is a pediatric dentist and the owner of Holy Tree Pediatric Dentistry in Simpsonville, South Carolina. She has been in private practice pediatric dentistry for over 20 years and maintains an active role in the AAPD while also acting as a board examiner for the ABPD. She completed her undergraduate training at Florida State University before attending dental school at the University of Iowa. She completed 2 further years of training in pediatric dentistry at the University of Texas Health Science Center in San Antonio, Texas, and is board certified pediatric dentist. Drawn to pediatrics in large part because of the unique educational opportunities the field affords, Dr. Bynum sees her office as both a clinic and a classroom. She considers every visit, no matter how routine, an opportunity to teach and motivate her patients. I love that. Dr. Bynum is a Diplomat of the American Board of Pediatric Dentistry and an active member of the Southeast Society of Pediatric Dentistry, the American Academy of Pediatric Dentistry, and the American Dental Association. She has lectured and written numerous articles on customer service, marketing, teamwork over the years. Dr. Bynum has lectured and written numerous, it's repeated, sorry. But thank you so much for being here. Today, we can come up with a topic. So we just said it's going to be running our mouths because we love doing that in this field. This literally could go anywhere, but we all know that Dr. Bynum is amazing at tongue tie and phrenectomy. So we have put a couple questions together for her. If anybody here in the audience has questions on Zoom, you guys can just type it right in the chat box and we'll read it to you. Read it to everybody. And if you guys are on Facebook, I have my phone with me that I'll be checking. You guys can also post your questions in the comments on Facebook. So here we go. Dr. Bynum, how long have you been assisting patients and families dealing with tongue ties?
10 years. We're going on 10 years now. And if I could just back up a minute and say hi, I have a lot of friends on here. And I hopefully have a lot of names on here that I will get to meet and know as we all sort of go down this rabbit hole together for the next few years. And the other thing I wanted to say is that was all really nice things that you read about me, but none of that prepared me for stepping into this field 10 years ago to help families with tongue ties. So I think a lot of people on this call and a lot of people that we've all met know that it's, definitely learning on the job, boots on the ground training, and trial by fire.
That's so true. All the courses that we're putting together with Airway Circle, I'm trying to focus on experience. And I'm telling everybody, these are things that you don't really learn in any course. These are things that we all have learned from, treating patients and seeing different cases come our way. So it is so important for us to speak to each other. That's why we started Airway Circle. We're here. I don't know how many specialties we have in the room right now, but if you guys can write down in the comments, both on Facebook and here on Zoom, let us know what you do, who you are. And just by being in here in the same room, you guys are going to start networking and connecting with each other. You just never look, we have a chiropractor. Yes. Awesome. This is amazing. How did you get started with your training and education? And did you learn any of this in school?
I didn't learn any of this in school. I think a lot of people my age, I know you think I'm 30, but I'm really 53. A lot of people my age, we were taught back in the day that if you could stick your tongue to your out to the vermilion border, you were good to go. I'm not really sure who came up with that lipness test, but it is inaccurate and fallible, and it's laughable at this point from what we all know on this call. But I got into this because I had a lactation consultant. It was actually a mom who had brought her kids to me just as patients, and she had driven to Columbia, South Carolina to get one of her children treated, driven all the way to Jacksonville to get another child treated. And in the midst, and you hear these stories a lot, in the midst of treating your own family, you become passionate about this. So she pivoted her career and she became a lactation consultant to help other families. And she knew that I practiced with my husband, who's a general and cosmetic dentist. And she said, look, I'm training and I need somebody in town who can do this. And as I see everybody posting over here what they're good at and what their specialties are, in every area, oh, I don't have a myofunctional therapist to work with, or I don't have a lactation consultant. There's always a missing component. And I was the missing component at the time. There was nobody willing to do this. Long story short, my husband had a laser. She strong-armed me. And I threw on some big girl panties and I did a release on one of her patients. And 10 years ago, there weren't YouTube videos to watch. There weren't courses to take. There weren't organizations like you have here to bounce ideas off of and learn from mistakes. I was definitely in the Wild West, and just I really believed firmly in what she was telling me, and I wanted to be part of it. And just kind of took off from there. And some of you on this call know this story, but my very first patient, baby that I treated, the mom and the dad both came to the appointment. They knew this was my first time doing it. The mom didn't come in the room. The dad held the baby. The mom looked like hell. She hadn't been asleep. The scenario. Yeah. The dad was well put together. He had dressed nice shoes on. I said, I see you're going to leave your wife at home today with a fussy baby. And he said, yes, I have to go back to work. And I said, oh, what do you do? He said, well, we both work in the same law firm.
Oh. My goodness.
My first baby, and both parents were lawyers. And I just said, okay, God, if you want my first patient to be the baby of lawyers, I can probably treat anybody else's child at this point.
After this one, that is hilarious. Oh my goodness. Well, they're great advocates for you afterwards. So yes. That's amazing.
And that is, I think everybody on here could get on and tell stories of how our patients do become our advocates, because so many other professionals in our field want to poo-poo this, and it takes the parents to become the advocates. I did a baby today, and the mom's already like blowing up Facebook and Instagram with, how well they're feeding, and, some other family's going to see that, and maybe in another city, and maybe coming to see one of you on this call. So it's just, be the pebble in the pond.
Exactly. And I tell everybody whenever we have one of these lives, every single person in here is responsible for growing the field. The little time, if you think it's not much, just sharing a video like this with a colleague or in your, Facebook wall, you might reach that one parent that is struggling, or you might reach that one professional that also did not know about this before. So you really have no idea how much you can move the needle by just doing, simple acts of raising awareness, talking about this stuff. So every single one of you are very important for growing the airway, myofunctional breathing, tongue-tie field. So kudos to all of you being here at 8:00 at night, Thursday night. Let's talk a little bit about stretches. Why is it so important to do stretches or exercises after the release?
Because you want the best success. Autumn Henning, many of you know her. Her great analogy is, it would be if your fingers were webbed together and you remove the webbings and you just held your hand there and you didn't do anything with it, it's going to grow back together. And parents can really understand that if you hold up your hand and you show that to them and explain it. And then also if you say, I'm going to put your finger in there, that doesn't hurt. That's, a lot of the comments you'll see on social media is, oh, I don't want to do the stretches. They cry. Babies cry for a lot of things. And it's just really helpful to put it in perspective for the parents. And I like to do a stretch on the baby before I do the procedure. The parents want to see that a lot of times too. And I point out, I'm like, look how pissed he is. We haven't even done anything yet, and he's pissed. I put the glasses on and he's pissed. So, just letting them know that pain and discomfort are totally different things. We don't want anything that we're doing pre or post release to be in the pain category, and nothing that we're all doing should be. Some things may be uncomfortable, but pain is not a word we should be using. Another great thing to tell parents is we're doing this for your child. We're not doing this to your child. A lot of parents come in the room, oh, we're having to do this to you. No, you're doing this for them. So a lot of it is just, your verbiage, and thoughts become things, and we just try to empower parents that way.
That
The
is so
stretches are,
true.
back to why stretches are important. If you don't do them, then you get, those are the people that blow you up all over social media. Dr. Bynum did it and it didn't work.
Exactly. I always
Or
tell
they go to a
everybody.
provider without any support, no support on the front and back, and all of a sudden these things don't work. Well, there's a lot
Exactly.
more that goes into it.
Yes, I tell everybody, it doesn't matter where in your body. If you have an open wound here and an open wound here, and you touch them together, it's going to heal back together. That is
Right.
what healing is. Healing is reattachment. It's just natural. So it's so important to keep those tissues apart as much as we can, not only post therapy, but also pre therapy, depending on the age of the patient. Obviously, they're going to need different approaches and different treatment, but so important to make sure that you are working with a team. The release only alone might not fix everything. Myofunctional therapy with an older patient alone is not going to fix anything. So all of us working together, we are going to increase the prognosis for treatment for all of our patients. What are some of the most remarkable or drastic changes you have been a part of when helping patients with ties?
Ooh, I can get, I don't get emotional much. Dr. Brian knows that, he's on this call. But these, this has re-upped my love for being a pediatric dentist. Doing MOs and DOs isn't very sexy anymore after doing dentistry for almost 30 years. But helping these families and seeing the instant successes, just ones that come to mind. I had a mom come from Charlotte. I've done 3 of her kids. They used to live here, and now they've moved to Charlotte. So I just did the 3rd child, and a lot of torticollis, leaning to one side in the carrier. And all you moms on here, when we're driving our car, we're constantly rear view mirror looking at our baby in the back. And she wrote a text when she got home, and she said, it's an hour and a half from here to Charlotte. And she said the whole way home, the baby's head turned the other way in the car seat. And babies can't lie. Babies can't manipulate. Babies tell the truth. And I just thought that was a really cool thing to see. I had another patient that wasn't very flexible. And when I finished the procedure as an adult, she laid the palms of her hands on the floor. Dr. Brian was there. He watched it happen. She was a SLP, and she literally laid her hands on the floor. I was like ready to do mine right then, because I wanted to see if that would happen. That was miraculous to me. And then probably
Wow.
my favorite story was a 17-year-old girl that had been to multiple, had tried multiple modalities to help. She was underweight. She choked on food. She didn't eat in front of friends. Her social life obviously suffered. And I didn't even get in the whole rabbit hole of her sleep or medications or anything like that. I didn't know much of her story, but I knew enough to know how much she had suffered at the age of 17. And her mom was crying at the consult, and I said, "Or what's wrong? Are you okay?" And she said, "You sound so confident, and I just want to believe you so much, but we've heard so many times that X, Y, and Z is going to fix this." And I said, I am confident. I believe that you found the right, this is it. This is the thing. And the mom wrote us a letter a few months later, and she had started her freshman year of college, and she joined a sorority, and she was eating in the sorority house and had friends.
Wow.
And I mean,
Ah,
middle school and high school can suck for everybody. We all have stories, training bras and up, right?
yes.
But this poor girl, what she probably went through, and she got her life back.
Wow.
And I just love that. And I think that's one of the reasons also that I've decided to take this step into helping adults, because they come in and they've suffered a long time too. And there's grown men and women wetting the bed or getting up 10 times a night. And
Or sucking your thumb still.
right. And they're not talking about that at their supper clubs, you know? And there's a lot of shame built into a lot of this, and it shouldn't be that way.
I do want to invite everybody that's on the call right now. If somebody wants to unmute and tell us a story that it has happened with their patients, I would love to hear from you guys. I'm going to give you a little bit of time to create some courage, and then you can come and turn on your mic and just share. One or two people can share some of the stories, something that they have seen or that it has really touched their heart. It's so important for us to share these. And while I'm waiting, I took Benny this morning to therapy. He's doing occupational therapy, physical therapy, speech therapy, all of it. But there was a little boy there, and he's probably 18, 19 months. And I'm looking at them, treat this little boy, but mouth wide open, high vaulted palate, very narrow. He looks like an adenoid baby. You can tell he just cannot breathe. And they're trying speech, they're trying as much as they can. And I don't know the whole story of the little boy, but there's such a big gap right there in between, when it becomes a little bit tougher to do a release on a baby, or when, most myofunctional therapists won't treat kids until they're 4 or 5 years old. We have moms message us constantly, every day, like, what do I do? I know that my 1.5-year-old is mouth breathing. Who can help me? I'm constantly sending to speech, OT or IBCLC, depending on the case. But, with this specific boy, the reason I'm bringing this up is because I could tell that his issue was structural. He had a lip tie release, he had a tongue tie release, but he could not physically close his mouth. I could tell how high his vaulted palate was, how narrow he was. At that point, what do you do? What are the options for a child who's, around the age from 1 to 2 or 3, whenever it's a structural issue? Most orthodontists and, airway dentists are not expanding kids that early, but you're a pediatric dentist and brave. So do you have any?
So much of that goes along with compliance, right? I mean, you don't have to be compliant for me to be in your mouth for 30 seconds to do a laser tongue tie release. But for all you other therapists on here that, are treating on the front and back end, you have to have a lot more compliance and a lot more trust built in. And sometimes you do have to table those things, and you have to have a compliance from the parents. That's a huge part of it. I would say you said that kid was how old? 3?
1.5, about
1
19
and a
months.
half. I mean,
I know.
I've seen, families who are super bought in and want to try things. I mean, getting some more real estate in there by using some sort of a Myo Munchie or, a Vivo starter or something like that to grow some real estate for that tongue. But you're right. It's kind of like no man's land right there. It's really hard to treat those patients. And I've had patients that have, they've gone to the myofunctional therapist. They've tried to do some things, and the therapist has said, I don't think we should do the release yet. I think we need to get some more, some better compliance before we do this. So again, I'm such a small piece of this. The quarterbacks of this are the therapists that are doing these assessments and coming up with the full plans.
And that is so true right there. You should not release every single patient. It is okay for you as a therapist or a provider to get a patient that you take a step back. You have to look at the whole picture, and it is okay for us to, even though somebody has a restriction, sometimes it is the best idea not to do it. I know there's so much information out there that everything has to be released, but Kendra Males is saying, I will reconnect when home. Oh, she's watching in her car. Does anybody want to speak? I know somebody turned their microphone on a little bit ago. Going on 3. Anybody? Kimi, do you want to share anything? I'm going to call on you.
I have an example of just today, bouncing off of what you just said. patient was referred to me, and a baby, an infant, and they're seeing hemonc because this child has such a large hemangioma on their neck that they're actually going to biopsy it first. Like, it must be really odd and out of the ordinary. And the lactation consultant said, "Are you comfortable doing this first?" I said, "No." I said, my first question back to her was, "Can you keep weight on the baby?" And she said, "Yes, we've given mom the tools. We're getting weight on the baby. So that's when we're going to defer until we get this biopsy back, and make sure that, the baby's healthy and whole before we introduce something new for the parents to have to
Yes,
deal with."
definitely. Kimmy.
Hi, you can always count on me to say something.
Yes.
Well, I just, I love being a part of this whole world for patients, right? And Dr. Bynum, you're so right that like individually we're all just like one piece of the puzzle, but I love the Airway Circle community because Renata has allowed this space for all of us to come together, brainstorm together. I feel like for so long it was threatening for people to share information of like what their tricks were or what their techniques were, and there was a lot of like hoarding of information and hoarding of skill. But I feel like this space at least is very much supporting of all of us saying like, I tried this and I got better results, or I don't do this anymore because I found it's not so great. And I think that's so important because we all have the same goal. We should have the same goal, which is to make sure that the patients are getting the best care.
Yes.
And having, healthier and happier lives. And so Dr. Bynum, I'm curious, as you're transitioning more and seeing more adults, how do you feel as the release provider seeing the difference in like going deeper into the release, and how has that been a little bit of a struggle, maybe not, for you to like get into that space where you're going deeper in versus babies where you don't go as deep?
Right. Actually, adults anatomy is so much more clear to me. The genioglossus muscle it's meatier, it's bigger. I can see it quicker. I think the biggest difference is, and I'm not sure if deeper is the word, but what I noticed from babies transitioning up to adults is that layer of the fascia and the muscle is completely separated in a baby. It's you go through the fascia and you're done, and pay me and bye. It's so fast. And an adult, there's some dissecting going on because the fascia and the muscle have lived together for years and years and years and started to web themselves together. So I do, and obviously with a baby, I'm super, super quick because the parents want their baby back. An adult, some men who aren't compliant, but some are, they're compliant. And so you can sit there and you can think around with it more, and you can make sure you've got all your fibers out of there. So I do, it does take a little bit longer because I'm a little bit more strategic in what I'm doing.
Yes.
The other thing is that you have to know your anatomy. These people buying lasers and stepping on the pedal and, taking, I don't know, a 2-hour class at a Ramada Inn or something. I don't know, but it's not, that also gives this space a bad name. Not working collaboratively or just going rogue like that. Cause if you're friends with Suresh, he's shown some cases of people who have hit vessels that, and these are great providers. It can happen to any of us, but knowing your anatomy, knowing what you're doing is critical. And there are so many great courses out there now to help all of us learn this better. And what I love about this is I'm taking classes that chiropractors and lactation consultants go to. Didn't really see that on the radar ever. And a lot of you on here have gone to dental meetings, and you probably didn't see that on your radars. And it's just, I just love the collaboration.
Definitely. How about those situations where families do not want to do myofunctional therapy or see a body professional? They just want the tight release, and thank you very much. That's all I want. I just came here for a cleaning. Don't talk to me about anything else. I just came here for a tongue tie release.
Right. I can think, in 10 years, I can think back of times where I went back on my guidelines, I can think of one specifically. I had done 2 other kids in the family. The mom said, I don't have the money for the 3rd kid. I know exactly what to do. I'm having all the same symptoms. And the dang kid went on a strike and they didn't have support. And here they were calling the lactation consultant for help afterwards. And I look like an a-hole and I shouldn't have done it. And I was trying to help the mom. She was crying money and I was trying to help, and Murphy's Law, I made the situation worse. So sometimes if you get a couple of those under your belt, you're like, yeah, I don't really care. If you're not going to be on board here, we're just not doing this. An example would be, that's one thing for dentists on here who are doing this. I charge a flat fee, whether it's I'm doing your buckles and your tongue and your lip and your armpit and your whatever I'm doing, it's one price, because I don't ever want a parent to have to pick and choose what they can afford. And we'll figure it out that way. We'll figure our part out on the back end of how to get all that through insurance and everything. But we charge one price. Some families come in and say, well, I think I just want the tongue done. The therapist mentioned the lip, but I just, The therapist said, we're doing 10 sites. We're doing 10 sites. And
Wow.
I've learned that too, because you don't want to piss off your therapist either. I mean, we have to have each other's backs here, or we, all ships have to rise together. So I'm probably not one of the favorites in town, although I was the first in town doing it, but I'm very hardcore about what I will do and what I will not do, because like you said, Kimmy, I want the best outcome for my patients and families. And as soon as we step 1 foot off of our moral compass, there's a Google review. Yes. There's a Facebook post. Yes. And this is all horrible.
Yes. I had a specific patient that went not to the provider that I recommended. And she has many friends who were SLPs and were telling her what to do. My recommendations were different. And she kept saying, well, what they're telling me to do is different, and I trust them. And I said, well, ask one of them to treat the child then. I would love to be able to treat him, but this is how I do stuff. And it did not turn out great, because exactly what I said needed to happen, and this child reattached. And it was second release already, so it broke my heart. But that is why, you got to get therapy done before a release. If this child cannot suction yet, if it's an older child, my goodness, maybe they're not ready. They have to be able to at least suction to be able to get a release without some reattachment. Dr. Richards, would you like to unmute and tell us how you do it in your office? I'm going to put you on the spot too.
What do you mean? As far as how I run my office, or what?
You mentioned over here in the comments, no myo, no release in our office.
Yeah, so I'm very fortunate. I work with a myofunctional therapist, but I got lucky because of being friends with Dr. Bynum, or being mentored by Dr. Bynum, more like it. My team members have seen Ann speak many times. And so I had a hygienist who decided she wanted to go down this road. So now I actually have a hygienist who runs her own clinic separate from me out of my office.
Awesome.
And so it's great, because now 90% of my releases, my myofunctional therapist is leaning over my shoulder, and she's quarterbacking the case. And she'll be, I get done with the release and she sits down and she's like, no, I want this done. So, I've just learned that if they're not going to do the myofunctional therapy, you're not going to get the result. And so for me, I bow to the myofunctional therapist. They're the ones who know more about this than we do as the dentist. The release is the easy part.
I love that. Thank you so much.
That's how we do it. I don't do any infants. I'm lucky. I've got somebody on the other side of the river that does a lot of infants. So I do everybody 3 and older.
Very nice. And I'm going to I'm going to take this opportunity to ask you guys, if you have not joined our directory yet, we have an amazing growing directory of multidisciplinary professionals on Airway Circle. You just go to airwaycircle.com, you click on directory, and you click on add listing. You can put your Instagram, your Facebook, your website, your email, phone number, your photos, your logos, all your training over there. We are constantly sending patients to that directory every single day. And it's a great way for patients to find you, an extra way for patients to find you. So if you have not joined yet, please join us tonight. We have a question from Dr. Hernandez to you, Dr. Bynum. She says, so great to see you and hear you speak. For toddlers and older children with sensory issues, like ASD, do you consider sedation or gentle parent restraint? Any ideas you can share?
Yes, Pranima, I can't believe you're on here. You told me you had your own Zoom thing you had to do tonight. What in the world?
This is it.
So this is a great question she poses, because adverse oral behavior is very difficult. Special needs patients are very difficult. And luckily, when I was the lone soldier in town, I had another colleague who I convinced to come alongside of me, and he does releases as well, and he does oral conscious sedation in his office. So patients who would require sedation for anxiety, or even better, get sutures so that mom and dad aren't having to do these stretches and lifts, that is an option in our community. So people have that as an option, and therapists, I encourage you to reach out and find out what all your dentists are doing and using. And so I do think that's a great idea. And the back part of your question, Pranima, we welcome all parents into the room. We really encourage them to hold their own children. Their biggest fear is that they're not going to do it right. So we really put confidence in them that they've got this. We're going to guide them and lead them and show them how to do it. And the other reason I like the parents in there is my consult room is 10 feet away from the treatment room. And if they hear their baby crying, they're going to imagine it being so much worse than it is. I'd rather have them see their baby crying than hear their baby crying, or child for that matter.
Yes, I love that.
I hope that helped. Lots of love, lots of singing, talking. All my team that's in there is saying the parent's name, saying the kid's name. If the mom or dad's holding the kid, I touch that mom's leg or dad's leg afterwards and say, you did a great job. You're so helpful. They all need some cheerleading, because it's, a lot of these people they've been through hell, and they've had, a lot of these are newborn babies, and they're already being told something's wrong with their kid, and they're doing things wrong. I see there's another question down here about healing post-release. Is it a concern? It's always a concern, in my opinion, because, you're relying on the therapist to teach the release. I'm showing the release. You're relying on the parents or the daycare provider or the nanny or the grandma or whoever to remember to do it properly. And I do think that for the most part, we have great people here that get it taught properly and educate these families. Then there are just the wild cards out there that grow back together.
Yeah.
I'll do, and I'll think that was thick as crap, and they're coming back in a week. I just know it, and I never see them again, and they've launched and they're doing great. And then I'll have another one that I think is amazing. There was one that was just done by a pediatrician where they clipped it, and it was full of scar tissue. And I saw them a month later. I redid it, and I was like, we're solid. This is it. Freaking is back together again.
I have a question about that. I keep thinking, and I've just been telling myself the story. There's no research, I don't think, anywhere. But I believe that reattachment has a lot to do with the person's ability to heal.
Amen.
I feel like some people are just more prone to reattaching, depending on how your body is going to respond to that procedure.
But it sounds like an excuse when you've done it twice already.
I don't know. I just feel like
tough.
there's an effect for sure with like keloid scarring and just that like connective tissue healing for sure. I'll see that too. And it's like, are you sure you were doing your exercises? I was, and we see that they are, and watching them do them, the quality is good, but some people, do just have that. I've actually, I have a osteopath here in the Denver area who has been doing kind of her own little clinical research on this, and she works mostly with babies and littles. And then her husband, so they have a practice together, he works on more of like the older kiddos and adults. And so she has been kind of trying to put this protocol together, I guess, where she's doing certain things with her body work beforehand, and then letting me know about some techniques in their post-op wound management that will sort of not trigger that so much. So she's pretty adamant about not directly like stretching so much on the wound when they are more hypermobile and have that like connective tissue disorders. So I don't really have a protocol for it necessarily yet, but I'm just I'm more aware of seeing that now and looking for that hypermobility tendency and how to try to guide that healing to not be so quick to scar, I guess. But I don't really have the answers. I just want to say I agree with you.
And someone said on here, some providers want sutures, others don't. What is your approach? I do not like doing sutures. I do not enjoy them. I only will do them on adults. I've done a handful. The procedure's 5 seconds. The sutures are like 4 hours for me. It's excruciating. And I feel like we have great success with the CO2 laser. If I was having a bunch of things reattach or having problems, and my therapists were coming back to me and saying, hey, Ann, we got to do something different here, then maybe I'd consider suturing. But I don't think sutures are a deal breaker. I think they do have a time and a place. I think definitely an orally averse child, a special needs child, parents aren't going to be compliant, or they straight up tell you they're freaked out about putting their hands in their kid's mouth. Those would all be in the list of people that I would say you would want to consider sutures for.
Amazing. Allison is asking, are there any tricks to convince patients to get the release? I seem to find them, but all my patients who need them are scared of the procedure or aren't convinced of its importance.
This might not be the popular answer, but all of us on this call are in sales.
Yep.
We don't think we are, but we are.
Well, anybody really.
Yes. And we have to be confident. And Allison, I do not know you, and I'm not suggesting that you're not confident, but my thing would be, putting it, like Kimmy said, put it back on the family. You're doing this for them. You're not doing this to them. These are the benefits. Write out the benefits. Give them websites to visit. Give them, help be an advocate for them. But at the end of the day, the monkey has to come off of your back. You cannot own it. All of us pediatric dentists on here see a bombed out mouth full of cavities. We diagnose it and we never see the family again, and we don't know what happened. And we cannot own that. We cannot, take that on.
That is so true.
I don't have an answer for that, but I think if you can lay your head on the pillow at night and know that you communicated well to that family about how you want to see their child or their spouse or their baby thrive, it's on them at that point.
Definitely. And I feel like, knowledge is power. Stay over here on Airway Circle. Go watch all of our previous Zooms that we have in our podcast. We have so much content out there. The more you learn, the more confident you're going to be. And you are here on a Thursday night. You are the specialist. You know more than they are.
Right.
You know more than they do. So, eventually you're going to keep telling yourself that it's okay. You're there to guide them and to instruct them. And you know your stuff, So.
And I do think, God, you're so right on with knowledge is power, because the families that come in that come to see me, and I know the therapists that they know their crap, but they get to me and they're like, she only showed me the stretch once. Can you show me again? And what time am I doing this again? But the therapists who like dial it in and have taught those families everything, by the time they get to me, their anxiety is like a 1 on a scale of 1 to 10. Whereas the families who don't have as much knowledge on the front end, they know why they're there to do it, but they haven't been fully educated, I guess you'd say, way more anxiety. So for all you ladies and gentlemen on the front end, the more is better. More is definitely better.
Definitely. Let's see. The rest of Anne's question. Have you had patients return with reattachment following a release you performed who request a revision? And how do you manage that as a provider wanting to ensure the revision is a success?
Yes. So you can't just call me directly and say, I think it's reattached. You're going to go back to whoever did your functional assessment. They're going to evaluate it. Because some people just look under the tongue and think, oh my God, it's reattached. Well, something reattaches. You're gonna see something. And sometimes parents think that means it's messed up and it's back. So finding out, what symptoms have come back, and most of the times it's a kid or a baby that is launched, and then like 10 days later, symptoms are starting to trickle back in. And that's one of the first signs that you're getting reattachment. And sometimes the therapist can pop that back open and they don't have to come see me, but I still make them go back through the process of being seen again and letting that specialist tell me what they think. And I do all revisions at no cost, and I will do them for up to a year. And this baby that I was just talking about, I wrote this therapist an email and I said, like, I don't know why. I mean, it looked great. I said, I will give them every dollar back. I will redo it 10 more times. I will do whatever you want, whatever will help this family. Because this is when, I mean, you just, like you said, you fall on the sword. You don't know.
And it's okay not to have all the answers, right?
Yes. And I don't know if anybody else feels this way, but revisions come like deaths. They come in threes. I will have nobody that has reattachment, and then I'll get 1 week and I'll get 3 emails. Oh, I just saw him and I think here's a picture. I'm like, God, I don't want to see your picture of your scar tissue. Stop sending me that. So
Dr. Richard is saying suturing depends a great deal upon cooperation. Releasing a 4 to 8 year old is easy. Suturing is a whole different ball game.
Yes, it is.
Dr. Rose would like you to talk a little bit about your Plot the Tot course.
She just let me give a little plug in there. Thank you. So I teach that course with Autumn Henning. A lot of you know her. She teaches her own standalone TOTS courses and a lot of online things. And so blessed to have her literally a stone's throw away. We were texting last night because we had a major blackout. All of our electricity went out, 19,000 homes out. And she and I were texting last night about, oh my God, are we going to go to work tomorrow? What's gonna happen? Do you have enough candles? But she's become started as a colleague and has become just a dear friend. And about 4 years ago, we were discussing our frustrations in our individual fields. And it's very similar to what you're doing here with Airway Circle. We just felt like there needed to be something that brought us all into the same room and taught dentists what's going on with everybody else in this collaboration, and teach everybody else what the dentist is doing and why we're doing it and how we're doing it. And so it's a great 2-day course. We teach it right here in Greenville. It's wonderful. Autumn has a young child, and so she doesn't have to leave. She gets to go home to her family at night. I just like partying in my hometown. It's beautiful. Downtown Greenville is beautiful. But it's a 2-day course. We have a lot of exciting surprise speakers every time we teach it. And we teach all sides of it. Autumn comes from the myofunctional lactation speech side, feeding side, and I come from the how to do the release, like nuts and bolts of how to do it. And the coolest part is we drag out the lasers at the end. And we let everybody, all these therapists try to run out the back door. We're like, you getting in the front of the line. Let's go. You're putting on the gloves. You're going to do it. Because I think they think it's like, and the head rolls off. I'm like, no, you got to use the laser. And then you're a much better advocate when you go back to your patients.
Mhm.
I used it, I saw it, it's gentle, all the things.
I
And
love
another thing
it.
I would tell everybody on here, reach out to your people. I have gone and watched Autumn do an assessment. I have gone and watched my lactation people do assessments. You need to go watch the dentist on your patients or somebody else's patients and see what they're doing. Because then you go back to your patients and you say, I saw her do it. I know
Yeah.
exactly how she does it. She sits here, she uses this, she calls it the jelly, what that you get to pick your glass, whatever the thing is. And that again relieves anxiety and helps your families buy into the whole thing.
Yes, you
So
guys
Plot
are
the Tot,
such
2 days. We teach it twice a year here in Greenville. We have a really fun time. Dr. Brian's taking it. He brought his whole team. He's typing
Yay.
something snarky right now, I can tell.
You guys are such a great team. When is the next one?
We have our next one in August.
Awesome. Okay, coming up.
And I think either today or yesterday was the last day of early signups.
Oh,
But
darn it.
it's
It.
super fun. And then that's the other cool thing that we get to sit back and observe is the relationships that get built out of that, and people leaning on each other and saying, God, how did you go talk to that dentist about how crappy that release looked? What did you say to him? How did you forge that conversation and repair it? So it's really awesome.
That is so cool. Dr. Hernandez has a great tip over here. She says that in her practice, they create an airway awareness newsletter. That is such a good idea. Thanks for sharing that.
That's because Pranima doesn't sleep, and she does all kinds of amazing stuff like this.
Wow. Hiba, I will share more info about Plot the Tot on Airway Circle. If you guys are not part of the Airway Circle professionals Facebook group, just request. Make sure that you put your profession, otherwise you're not allowed in. Dr. Richard says some dentists release themselves. I think Dr. Baxter showed him releasing himself in his course.
Brian's talking about somebody else.
Okay, I know some crazy thing. Oh, you did it too?
Yes.
Really?
Yes, I did. I did my whole family. I'm just nutballs. But
oh my gosh, I love it.
yes.
Let's see if there's a question here. June, Plot the Tot is the best. Awesome team. I learned a lot. When I attended, we had a pediatrician and a chiropractor in the room. Amazing.
I did sutures on that pediatrician. That
really? Oh my gosh, how cool.
And she has now left her group practice and started her own practice, gone out on her own, because she was just running up against too many walls inside of a group.
Wow, I am not that. Yes, unfortunately, whenever you work for a group, you do have to deal with that. But I'm not that far from you guys. I need to invite some providers from Savannah to come up with me.
Come on,
Greenville. I just gotta find some providers in Savannah that are willing.
Right?
Yes. We are almost at our hour, so I'm going to ask just a couple more questions. We all know that you practice in the same building as your husband, who is a general dentist, and you share a CBCT machine. Tell us about what type of CBCT machine, what type it is, and has it come in handy when helping you treat your patients with airway issues or tongue tie?
Sure. I do not think, I would not recommend going out and blowing $100,000 if you're stepping into the airway space. I think if I had $100,000, I would spend it towards education before I would spend it on this tool, because that's what it is. It's a tool. It's not the number one tool. It's not the end all be all, but it has been a great tool. Like I said, my husband uses it. We have a Vatek, and I love it. One of the reasons I love the Vatek is they are not in bed with any big providers. They're not with Henry Schein. So if you have a fallout with Henry Schein and you have to call them to come fix it, that's always awkward. So Vatek is a standalone company, and their customer service has just been amazing. The orthodontist 3 doors down from us just bought one as well, because they're just amazing. But it is a great tool to help you build a case with, and you have to be educated. You have to know that you're not taking the image in the same position you would take it for if you were taking it for implants. You're using a totally different adapter on the machine, because you don't want the patient biting end to end. You're trying to get the natural bite to see where the tongue is landing. But it shows great information. It shows adenoid tissue. It shows the airway volumetrically and with color. Parents can understand that. You can have a radiologist read the report and give you lots more information. You might catch a big mucus retention cyst up in the sinus, and that could be part of what your issues are. You can scroll through and see turbinates, and you can find a deviated septum. So it is a great tool. It builds a case, just like I don't think you can commit a diagnosis to one sleep study. I don't think you can commit a diagnosis or a treatment to one cone beam image. But man, it's been it's a cool piece of technology.
That is amazing. If anybody here wants to learn a little bit more about how to read a CBCT, how to recognize certain things, specifically TMD, also how TMJ presents, Dr. Dipash Sitaram, who's an amazing dentist, is going to be doing a course for Airway Circle. It is 2 hours, $99. It's live on June 18th at 9 a.m. Eastern Standard Time. It is going to be recorded, so if you cannot be there live, you can rewatch it later. But if anybody has a little bit more curiosity or wants to learn, how to look at these structures on a CBCT, he's going to be teaching us all about it. So super excited for that course. And you have been helping patients with ties for close to 10 years. What are some of the things that have changed in your community over there since you started practicing?
Lot more therapists getting on board. 10 years ago, there wasn't a lot of oxygen at the top of the mountain, a lot of arrows coming at you. There's still some of that crap that goes on, but a lot more acceptance, a lot more collaboration. A few years back, I got pulled into the lactation department at the hospital and told that if they saw my name on any referrals, I was jeopardizing the job of that lactation consultant.
Wow.
Not like I'm handing out donuts to people up there and kissing. I mean, I'm not recruiting that at all, but frustration, a lot of frustration, and a lot of politics, lots of egos, things like that. But we're I don't know. I think we're in a lot better place than we were 10 years ago. Things that have changed. I started with a diode. That's what my husband had. Changed to a CO2. I feel in my hands, the healing is much better. The babies are soothed and calmed down a lot faster right after the procedure than using a diode. We used to say, put your finger in the wound, and we learned that, boy, that just really made a wound angry and probably caused some reattachment along the way. So we've really changed our, we're a lot more gingerly with those wounds, with wound management.
What do you guys offer for afterwards? I've had some providers say just warm salt water rinses is fine. Some of them recommend Stella Alive, arnica, turmeric. I have heard almost everything. What do you guys usually recommend? And I know it's different for age, but
right. And I think I would love to hear people's comments over there, what they recommend. A lot of parents come in already knowing what they want to do, and they're spraying the essential oils and have the coconut stuff flowing. and I'm just like, hey, you do you, boo. You know what you're doing. You know more about this than I do, so you just go ahead with that. If you've ever had a ulcer or a sore in your own mouth, why don't you try putting some salt in there and you tell me how that feels? I don't think that's a good idea.
Okay.
I do not recommend vitamin E. Some parents think that that's a good healing thing, and that will make a wound heal too quickly, and that's not what we want. So that is about the only thing that I will ask parents to stay away from is vitamin E. But I'm all about your hooey tinctures and your whatever you want to do, and 40% of everything that we do is placebo effect. 40%.
Wow.
You can take a Tylenol. I can take a placebo Tylenol, and my headache can go away as fast as yours almost. So I think whatever makes parents feel like they are helping. Frozen breast milk is great.
Yes.
Like whole breast milk in a dropper, skin to skin, anything that just helps. But again, if you're doing a 3 and a 4-year-old, they don't need crap. They just want to get a Happy Meal and go home and play with their friends. They're not writhing around on the floor after this is done for 2 and 3 days. So I think that's our sign right there that this is not, I mean, some of the dentistry we do on here is more involved than a tongue tie release.
That is so true. And how many 1-year-olds, 2-year-olds are getting all these cavities filled? So definitely. What are some of the silliest, most outlandish things you have heard about tongue ties since your journey started?
Oh my God. I had a pediatrician tell a mom 2 months ago, he's just a happy spitter. My image comes to mind of, so when you and your husband go on a date, do you just like happy spit your food and happy spit your drink? Like, what even the hell is that? Like, where is that even a term? A happy spitter? Stuff like that. I've heard if you cut the tongue, it's going to go down their throat. I'm not talking about I'm talking about like professionals telling that to patients and families.
Wow.
And just, it's funny, but it's just not knowledge. And sometimes my husband and I just talked about this last night, had a general dentist numb up a kid to do fillings on 8 and 9, couldn't get him numb, told the parents the kid had a genetic condition and they needed to see a pediatric dentist because we deal with genetic conditions like this all the time. You're insane, man, is what you are. So here you have made crap up and now their parents think something's wrong with their child.
Wow.
So for these people who don't say anything before you say something ridiculous and ludicrous.
Inaccurate. You guys write on the comments the things that you have heard. I want to read them later.
Lazy baby. We've all heard that. No, teenagers are lazy. Babies aren't born lazy. That's not a thing.
Yeah. They just can't rest their tongue. They just like keeping their tongue there.
Yes.
And
I had a dentist say, don't let them do that because the tongue is supposed to be in the bottom of the mouth. And if you do that, it's going to pop up in the palate. Okay. Yep. That's true. That's what
God forbid the tongue goes up.
Yeah.
And is asking, how do you assess adequacy of tongue space for an adult release?
Very difficult. I'm usually not the one driving that bus or quarterbacking it. Sometimes these patients are already in expansion. They're already in ortho. A lot of times this gets caught in a tongue thrust when an orthodontist can't get the bite to close. They've already dinked around for 10 to 12 months and they can't close it down with rubber bands. And then they get educated and realize, oh my God, I'm never going to get this case finished without some myofunctional therapy and a release here. So a lot of that is handled on the front end. And therapists, you know what you're looking for. You're looking for a scallop tongue. You're looking for inefficient suction, not enough real estate. And then you have to have those conversations. Even if a patient's like, I'm not doing ortho, my palate's 1,000 feet high, I don't have the money, I don't do whatever. I've done releases on some of those patients and I still think it helps. I've got patients that snoring has stopped, neck tension has stopped, headaches have stopped. So I think being realistic with what the expectations are, I don't think any of us on here can say they've made a patient worse by helping them in this way. I just don't think it happens.
That is so true. I love it. Anne is also asking, how common is true macroglossia in your experience?
I really don't even know what the definition of like how many millimeters or how much does it weigh at that point. I feel like macroglossia may be a mirage for us because it's really the tongue sitting in the wrong place. Our mouth breathers, boy, those tongues look so much bigger. Think of our Down syndrome patients. They get cracked and they get swollen. So I'm not sure I know the answer to that. And I don't know how what true macroglossia is. I don't even know what microglossia would really look like. But I think some of those tongues that look big after we've got them treated and trained, they don't look like that anymore.
Alrighty, guys. Last question. Why are you so passionate about helping these patients, and how has it impacted the way you practice pediatric dentistry?
I think it's helped me stay in the game a lot longer. I'm not as burned out as I could have been before this all started. I've also made so many new friends that aren't dentists, and that's really cool to have that and to have other friends and specialists and colleagues to lean on. So, and I just think it's, for a lot of us on this call, it took us years and years and years to get those letters behind our names, to do all the things we're doing to help these patients. And while all of our other friends were driving nice cars and buying their first houses, and a lot of us have never known instant gratification. And this is instant gratification. The feedback we get from these families, it fuels me, man. It fuels me. All it takes is one of my therapists to send me a text and say, they took 2 more ounces. Like, I will do a backflip if you took 2 more ounces. Like, that's amazing.
Oh my gosh, that is fantastic. Dr. Bynum, thank you so much for being with us tonight.
Absolutely.
I knew it was going to be a great talk.
One of my favorites, actually, instant gratification. I did my assistant's 3-year-old, and she texted me and she said, he said the word fart. And he said it right. He put his tongue in the right place to say fart.
It's like, those R's, man. It's the R's.
That has to be the best one.
Yeah.
Guys, to let you know, we have a very, very special guest next week with us. We're having Brazilian orthodontist, Dr. George Faber, coming to talk to us. He actually just presented at the AAO about MARPI. He is huge, and it's funny because I posted a photo with him. I didn't know who he was, but I posted a photo of him, and I had my orthodontist friends in Brazil messaging me going like, are you serious? Like, I've learned so much from him. So this is going to be a fantastic talk. Please join us next Thursday, June 9th at 8 p.m. We also have Rebecca Clark's self-care course on facial massage and lymphatic drainage. This is literally AC for Airway Circle, AC care for me. We are trying to care for ourselves a little bit because we work too hard over here. So come spend an hour with us, bring your glass of wine, bring your facial products, and Rebecca is going to guide us in doing a facial massage and teaching us how to do lymphatic drainage in ourselves. We know we all need it. We also have ACBC, our book club, that is starting right now. June 12th is our first meeting. We're reading guests. So if you guys have read it, please join us. If you haven't, please pick one up. We're going to have Dr. Hendon and Dr. Gelb there with us. June 12th, it's a Sunday at 6 p.m. And we have Launcher in our Myo. It's starting our second class August 1st. And then we have the class with Dr. Dipash on June 18th. So June is packed. We have so much stuff going on, but very thankful for everybody that joins us every time that we come on here bringing something to you. Please help us by sharing our posts and sharing our podcast. The podcasts are open to everybody. And thank you so much. We'll see you guys next week. Righty, bye-bye.
Bye.